A superbug that targets children is raising great concern tonight. It causes painful ear infections, and here's the key part. It's resistant to all of the antibiotics approved for treating these infections in children.
Hi, how are you today?
A visit to the pediatrician is usually followed up with a stop at the pharmacy to pick up an antibiotic, a promised cure for what ails you. But that may be the problem. Many health officials are blaming emerging superbugs on the overuse of antibiotics. And a study out today in the Journal of the American Medical Association adds one more bacteria to the list of superbugs. This one causes ear infections.
Middle ear infections are the most common cause of bacterial infections in children.
A study of just over 1,000 cases of ear infections in children found one strain that's resistant to all the FDA-approved antibiotics. And the bacteria isn't covered by the vaccine used to fight these infections either.
If it's resistant to all the medications that are currently available on the market for these age groups, then it means that we would need to look for other medications that are not FDA approved.
That means doctors may need to go off-label and prescribe drugs whose safety are not documented. So what are parents to do?
I encourage parents to collaborate with their pediatrician to find the best treatment option for their child, which may not always be an antibiotic.
The American Academy of Pediatrics encourages watchful waiting, keeping a close watch on a child for 48 to 72 hours before beginning antibiotics. That's what Sherry Weisberg does for her 2-year-old son, Liam.
And if he didn't have a high fever, if I just noticed he was tugging at his ears but wasn't really bothering him too much, I would say, okay, I would sit and wait.
Well, antibiotics are sometimes necessary, but using them more cautiously could decrease a child's chances of developing these drug-resistant strains.
Toyotas are regarded by many people as very reliable cars, but Consumer Reports says 3 Toyota models